I would like to introduce Dr. Marcel Veltkamp, who's a consultant respiratory physician in the Netherlands with huge experience in sarcoidosis. He is a good friend, and I've asked him to present today some of his experience with sarcoidosis patients. Unfortunately, one of his colleagues and representative of the Sarcoidosis charity in the Netherlands was planned to speak as well, but informed us today that he's unable to do so due to illness. So apologies for that. And I will move on to Marcel and then introduce our Italian colleagues after that. Marcel, over to you.
Okay, thank you, Vasilis, for introducing me and be able to speak at this conference. I hope you can see my slides. Can you see my slides,
yes.
Vasilis?
Yes, if you want to move to presentation mode.
Oh, yeah, in my slide, it's now in presentation mode.
We can see all the slides on the left, so I imagine you need to click one of these buttons on the top. I don't know.
Okay.
Let me.
Share screen. No. Let me see. I will restart.
I mean, I believe that if you could share as you did your presentation, and then on the presentation, click on the presentation mode.
I can't see the share screen right now. I'm sorry.
That's okay.
So I share my screen now.
Okay, we can see your screen.
And now the presentation?
And the presentation.
Okay. Well, thanks once again for inviting me. We discussed this to give some input and how we think that management between patients and caregivers and researchers can be increased. So I put up a couple of slides just to give an introduction to you in England in how we manage care for our ILD and sarcoidosis patients in the Netherlands. So we have like an ILD network. But first of all, I want to start giving some short history about our own hospital, why we became a reference center. We have an old hospital, more than 100 years old, with also from the beginning an expertise in cardiology and pulmonology. We did the first surgical cardiac surgery with a heart-lung machine. In the 1983, we moved to the city of Nieuwegein, which is in the near of Utrecht, and we did the first single lung transplantation. And the founding father of ILD in the Netherlands was Professor Dr. Jules van der Bos. He participated in the first lung transplantation with a patient with pulmonary fibrosis. That is not in the COVID area, but this is the patient with physical
Marcel,
therapy.
sorry, we
Yes?
don't see your slides moving. We can only see your first slide at the moment.
Oh. I see my slides moving, so I don't know. Well, maybe. And now?
Yeah, that's fine.
Now you see them moving.
Yeah, we can see them moving, yes.
Ah, okay, thank you. So this is what I told about our hospital, and the founding father of ILD in the Netherlands was Professor Dr. Jules van der Bos. participated in the first lung transplantation in the Netherlands with a patient with pulmonary fibrosis. He had an interest in ILD and started collecting data from patients early 1980s. He did the first bronchial alveolar lavage in the Netherlands, and because of his work and expertise, he became the first professor of ILD in the Netherlands. And this is the starting point of our hospital as an ILD center of excellence for patients with ILD and sarcoidosis. We now have 2 locations in the center of the Netherlands. And why am I telling you all this? Because as a center, we have 3 important pillars. Of course, we want to give the best clinical care for our patients. But to improve patient care as a reference center, you have to do a lot of research, but also education for colleagues, but also to patients like like you have today in the UK. The head of the clinical department and my mentor, Professor Jan Grutters, heads our department, but we have a group of now almost 8 pulmonologists specialized in ILD and sarcoidosis, a lot of nurses who act as a case manager. So we have an increasing team. This is also the team behind us, a lot of research, etc. We also, and this is my part, have an important task of educating our colleagues in the Netherlands, but also patients. So we have different symposia, a yearly ILD symposia, but also ultra-rare disease. We have a sarcoid symposium for caregivers, but also for patients. We have ILD fellowships for young doctors who want to become more acknowledged in the field of sarcoid and ILD. And we have a lot of invited lectures. This is one of the pre-COVID patient day. This is a yearly ILD sarcoid meeting where we give lectures and answer questions from patients, which is also really interactive and highly appreciated. An important task of a reference center is do research. The head of our research department is Dr. Coline van Moorsel, and we have a big research department involved in fibrosis, but a lot of sarcoidosis research. I'm not going to do in detail every research theme, but we have 4 big themes. We have a big biobank where we store material of all ILD patients seen in our clinic. We do a lot of genetics, biomarker research, especially also in sarcoidosis, and in therapeutic trials, also for sarcoidosis. For the biobank, this is really special, and I think it's very important for research in rare disease. Patients can give their informed consent, not only to store some of their blood in a freezer, but we can also collect data on pulmonary function tests, CT, biopsy material, bronchial alveolar lavage, also from the other hospital. We now have more than 6,000 patients with unique ILD disease in our biobank, and it's an important source of research for our hospital. And you see all of the patients we see are from all the Netherlands. The Netherlands, of course, is not as big as the UK, but we see patients from all over the country. Well, one of the things is the collaboration. I was invited to give input in how we can improve collaboration. And when you think about research, there's a lot of collaboration worldwide. I asked one of my colleagues, how many centers do we have some kind of collaboration with? Worldwide, we have done research with more than 200 centers in 28 countries. And also in Europe, we have a lot of collaboration between other centers, also different centers in the UK, where we combine research. Also in the Netherlands, we have good contact with other hospitals, enabling us to do a randomized controlled trial in sarcoidosis, where we compare first-line therapy in treatment with prednisone versus treatment with methotrexate in patients with pulmonary sarcoidosis. It's called the PredMed trial. So regarding the collaboration in research, it has a good base. But how about patient management? How can we, in a national or international level, collaborate to improve patient management, diagnosis, and treatment? And one of the important things we have in the Netherlands is the ILD network. Here you see a schematic overview of the Netherlands, where we have 80 community hospitals. Where you see in the small round, you see the gray round, which is a regional ILD center. So in every province, there's one or two bigger centers who are dedicated to ILD and sarcoidosis. They do more complicated treatment like methotrexate or azathioprine in sarcoidosis. And we have centers of excellence. You see this, our own center, but also the Erasmus Medical Center in Rotterdam is a big center of excellence. And what we do is every center of excellence is committed to more regional ILD centers. And how do we connect? We talk to the doctors, but we also do a lot of video conferencing. At the Antonius Hospital, we have contracts with more than 20 hospitals, and every 6 weeks we have an MDD via video conferencing, and we discuss patients from the regional hospitals with our own radiologists, with our own team of pulmonologists. And why is that important? Because we want that all the patients with sarcoidosis in the Netherlands should be offered the best kind of treatment. And if there's difficulty in diagnosis or management, the colleagues in the Netherlands can have an MDD with us without the patient having to travel a lot. So I think this is one important structure about the care for ILD patients and sarcoidosis patients in the Netherlands. We feel that every patient should have access to the newest insight in treatment, but also should have access to new therapeutic drug trials in sarcoidosis. So this is what we do with the ILD network, as we call it in the Netherlands. We don't only have MDD with centers in the Netherlands. This is a picture of Conley Mateo, who is a pulmonary physician in Zambia. He was trained in our hospital, and that was during the first MDD we had with him and his team in Lusaka in Zambia. And we can also discuss ILD patients from Zambia together in our MDD. So how about the future? How can we collaborate, engage more between patients and doctor? Well, I think for the Netherlands, one of the strongest thing we have is the ILD network. So if you're sarcoid patients seen in a small community hospital, there is access to a bigger regional center, and when it's very complicated or you have to be treated with TNF alpha, you can be referred to an expert center. But if it's not necessary to be seen in an expert center, you can get the best care in your own hospital near your hometown village. So how about the future? I was asked to tell something about how we see this in a European way, improve patient care and research. Well, of course, every country has its own patient foundation. You have the SarcoidosisUK, we have the Sarcoidosis Patient Association in the Netherlands, sarcoidosis.nl. But there are more groups in Europe. As pulmonologists, we have the European Respiratory Society, where fortunately there's increasingly more attention to sarcoidosis. We have a worldwide organization, which is the WASOG. Colleagues from all over the world can join the WASOG. We have a yearly meeting, but this is more for research and physicians. We have the European Reference Network, and there's one new thing, which is the European Sarcoidosis Foundation, which is founded by Jules Prost. He is a Dutch patient with sarcoidosis. Unfortunately, he is ill today, or otherwise he could tell us something more about his foundation. But the reason he founded this is that he wants to see more collaboration between big centers in Europe, but also fund more research. So I think, well, in our country, the Netherlands, we have an ILD structure where we hopefully can offer all the patients the best standard of care and also access to research, but based on all the different patients societies or European societies. I would like to would happy to discuss your thoughts about how we can engage patients more at an European level. So that was the last slide. So I'm happy to take any questions or to start up the discussion.
Thanks, Marcel. It's very interesting to see different approaches. I will start by asking you, my first question would be, on the clinical day-to-day basis, what is the main challenge that you as sarcoidosis expert face when dealing with patients with sarcoidosis?
And you mean the patients we have in our own clinic or patients who are...
in your own clinic?
Yeah, well, one of the difficulties is when we get patients referred that diagnosis can be quite a puzzle. Most of the time, the diagnosis of pulmonary sarcoidosis can be diagnosed quite early, but we see a lot of patients with cardiac sarcoid, with neurosarcoid, with pain symptoms, and then it can be really a diagnostic puzzle. And this is very difficult for patients because they have quite a long time symptoms. There's a lot of uncertainty. So in my daily practice, this is one of the problems of sarcoidosis patient based on different organs that can be affected.
Mm-hmm. And my second question with regards to the Netherlands, I've listened about this in the past from another colleague in the Netherlands, but do you have any particular pathway for patients' disability on the basis of the sarcoidosis systemic symptoms? Meaning, can a patient with sarcoidosis in the Netherlands get disability because of the systemic disease symptoms?
And what do you mean get disability? They have complaints or a physical disability?
Physical disability. Physical disability.
Yeah,
I mean,
a lot of problems we hear is that patients, I listened to the previous speaker about fatigue, which is also a big problem for our Dutch patients. And my colleague, Professor Drent, Marjolein Drent, also did a lot of research about pain symptoms and fatigue. But what my patients often complain about is that they're quite young, so mostly they have a job, and it's very difficult to do their full-time job. And then they get hooked up in all agencies with when they can't work anymore. But there's an agency in the Netherlands where they can screen patients and say if they're good enough to work. But those agencies, those doctors there, they don't have the newest information about sarcoid. So you get a lot of frustration by our patients that I say to the patient, you have a lot of disability because of your fatigue and pain. But the doctor of the working society, he says, well, you can, as a patient, you can go to work. What's the problem? So this is a real problem in the Netherlands, and I think it will be the same in the UK.
No, I completely agree. I think that this is a problem worldwide, and it would definitely be a topic that it would worthwhile investing time on, because as we have said during this day, the peak of the incidence of the disease is around 40 years old. So this is the most productive time for every patient. So it is very important to actually do what we can to help them, because in terms of numbers, their lung function may be normal, their cardiac function may be normal, but they actually cannot really, as you say, go to work or even perform day-to-day activities. So I think that is critical, and would be something that it would worthwhile engaging also with governments if possible. I think that personally, I think that this should be one of the goals of all the charities and foundations driven by patients in the first instance. My third question. My third question.
Can I comment on that? Because just before COVID, we had the intention with the Dutch Patient Society to give a conference, not for pulmonologists, but specifically for general practitioners, doctors who work in the working society, who screen those patients, to get more information about this disease to the colleagues who guide these patients back to the working track. So I hope we can get this done after the COVID.
And my last question was, do you think do you have any problems in accessing medications such as anti-TNF or any other medications for sarcoidosis patients? This is something that we face because NICE has not approved medications like this for sarcoidosis, and therefore we have to apply for individual funding for each specific patient.
No, in the Netherlands, as a reference center, we have different agreements with the health insurance that we can give our patients, like, for example, infliximab, Remicade, or adalimumab. So there's a special budget for us in the reference center to give such kind of treatment. That's
interesting to know.
Yes.
I think what you covered is really important, and it does match with a lot of things that we do. I think that the more closer that we are with patients and hearing their problems with days like this one, it is very important because we can design studies based on their problems rather than industry-driven studies per se. So thank you very much for attending and giving us your talk. And if you don't have any other comments, I will move on to Filippo Martone. And
thank you.
You're welcome. So along with Marcel, I had invited Professor Paolo Spagnolo, who's the ERS president of the sarcoidosis group, but he's unable to attend today. So Filippo Martone is the president of the Italian charity for sarcoidosis. Had participated last year, and I felt obliged to invite him once again, given his excellent talk last time. Filippo, over to you.
Thank you. I try to start. This is the end. Beg your pardon. Okay, I thank you very much to have the possibility to speak again to this fantastic day, a day that is very close to other manifestation that we do in Italy, and I will talk to you in a while. We are an association founded in 2011. We are made of people with sarco, families and friends, but also doctors that wanted to defeat this disease. Today we are in 260, but we assist almost 4,500 people via web or by phone, etc. The Therapeutic Alliance is a very important thing for us, and your words, a couple minutes, you told us a couple of minutes before, is very on the same way we see this problem of the sarcoidosis, the life of the sarcoidosis from the doctors and from the patient standpoints. They told us that the Therapeutic Alliance is the means by which a clinician and a patient hope to engage with each other and effect beneficial change in the patient. Other told tell us that is arguably the most important common factor to the therapy outcome. We think that is a fundamental tool to develop both the knowledge and of the disease and the tools to treat it, and when possible to heal it. We also do patient days. We call it Scuola di Sarcoidosis because it's a moment in which both patients and doctors learn from each other, and is very important for us. We are doing it from 10 years until now. But we also fight with doctors for obtain things. As you told a while ago, we had problem to use anti-Tnf medication, but we fight with doctors, and Italian medicines agency told us our medication. Give us our medication. Also, we found the researches that can help our doctors to cure us, but give also doctors a topic on which do research. As you usually know, 7 years ago, a group of us association with the ERS started the work for the treatment guideline of the sarcoidosis, treatment and diagnosis. The group was day by day greater and involved also the European Lung Foundation and at the end also ETS. Today we heard a lot of time of this new guidelines, so I don't want to bother you. We also, as a group of doctors and patient association, worked on topic very important for us as the COVID, as you surely remember from the last year, but also to establish what is important for patient as a basis for the guideline. We, thanks to the ELF, we formed a patient advisory group specific for this pathology that involved, tomorrow will be 11 associations of 11 different countries. The charter of the patients are just published some days ago. But also we had the possibility to participate on Congress together with doctors. Thanks to the WASO, this was in Belgrade a couple of years ago, and these conferences are very school of sarcoidosis for both doctors and patients. Tomorrow, the day after tomorrow in Bologna, we will have another great conference in which will be present all doctors and the patient representative together working for obtain almost comprehension and reciprocal advantage. So my proposal is very clear and is that we have to work for the objective you Vasilis told us a couple of minutes ago, and working together it will be almost more easy than in the past to obtain it, if you agree. Thank you for your attention and to listening once again.
Thank you, Filippo. Thank you for all the hard work. I'm really impressed by the work that you are doing, and it's really important to bring patients closer to the consultants and in particular the sarcoidosis specialists. I would obviously you have shown us activities that are increasing awareness of the condition, no doubt. The events that you've described are open to patients or open to healthcare professionals, and how are you trying to tackle the challenge that everybody is facing with the lack of awareness of the condition at the primary care level?
The day after tomorrow, we will have also patients and doctors in two different communicating rooms that can see the same things. In the room of the doctor, we will have students of every kind of discipline, medical discipline, and we are hardly trying to involve family doctors and all the specialists of all the different disciplines that are involved in the team that taking care of the people. It is a very hard fight because normally we tend to keep a pathology into a specialty, but sarcoidosis is another demonstration that we need a multidisciplinary team and a multidisciplinary way of thinking on every pathology. So I think that the Patients Association can be a good drive to obtain a change. Working together with health politics to obtain a novel way to build a health system. So all these congresses are intended in that way.
Thank you. As a patient advocate, which do you think are the main challenges, the main issues that the patients would like to be answered, would like to be heard?
Starting to the very big and important things, obviously to obtain taking charge in every part of the country, because nowadays it's not so easy to obtain it. In the second, we can tell that taking charge of the pain, of the fatigue, and of the different and not so evident manifestation of the sarcoidosis, it will be much more important. And the social taking charge is completely absent, and is a very important need that you also underlined a couple of minutes.
And finally, do you have problems accessing medications?
As I told you, we solved the infliximab problem, but we now have to work hard on the new guideline to let the Italian Agency of Medications put all the medication cited in it at the use of the doctors. So less problem than before, but we have to work on it.
Excellent. Thank you very much. So thank you very much for attending. I don't see any questions in the chat. Let me check. So there is a point that the whole issue of lack of awareness was even more noticeable in the two different A&E departments that have been taken. Yeah, so I think every single patient has experienced an episode of lack of awareness, which is disappointing. Thank you very much, Filippo, and I'll give us 5 minutes until the next session. Thank you.